It's interesting when it comes to peripheral artery disease that everyone's presentation is different. And so,
Mm,
with the guidelines that are out there, not everyone fits into the box, right? We had Dr. Devin Sarkowski, who's a vascular surgeon, who came on recently, and he said that while everyone is condemning doctors for treating what are called intermittent claudicants,
mhm,
that is an early stage of PAD
mhm.
in which a patient, it's defined by a patient where they can walk, they get a cramp, they try to push through, and when they can't go anymore, they stop, they rest, pain goes away, and they walk again.
Indeed, yeah.
And the whole theory behind not treating them is that there's still so much patients can do in order to improve their prognosis and delay having a procedure, never even having procedure in so many cases, actually, in most cases. But there are exceptions to the rule. For example, if your job relies upon you to walk, 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 and you don't have that time to rest, and your safety might be in jeopardy or your job might be in jeopardy because you can't consistently walk, and that cramp at some point within 5 to 10 minutes literally stops you in your tracks, then that might be a reason for you to have that discussion with your doctor to say, hey, I think I'm the exception to the rule. My lifestyle is limited. I might be an intermittent claudicant. My lifestyle, my livelihood is
Mm.
limited by this cramping. Can you go in there and just kiss it with a balloon
Yeah, I
to
like
give
that.
me just a little bit more flow? It's actually a technical term. Say that to your
Oh,
doctor.
really?
I dare everyone. I would love to hear because that is a term that I heard over and over and over again. I'm just going to
Okay,
kiss it with a balloon. Just
great.
going to kiss it with a balloon. And so there are other situations he mentioned as well. And I had never thought about this. He has patients that are in cardiac rehab that
Mm,
the PT, the physical therapist, will come to him and say, this patient is not getting the cardiac benefit of this therapy because they have to stop walking every 10 minutes. I need
mm,
them to walk at a brisk pace, get their heart rate up for 30 minutes to get them through this PT and make it effective. And in those cases, it makes sense to just go in and kiss it with a little balloon, just to give that patient a little bit more blood flow so they can make it 30 minutes to get through cardiac rehab and get those benefits.
mm.